We press on. Since we first told you about the pill pushers using TikTok and telemedicine to sell prescription drugs, the problem has gotten worse. Adderall, Ritalin, Vyvanse are all highly addictive drugs. They're being prescribed more than ever. And there's no way for the doctor on the other end of the Zoom to know if their patient has genuine symptoms or is just looking for a quick high. Joining us now, Dr. Melissa Shepard, board-certified psychiatrist, former resident at Johns Hopkins University. Doc, good to see you. The Economist now has picked up this story, among others. We've gotten to the point that people who got these drugs during the pandemic by telemedicine are now causing themselves more harm than good with them?
Well, I think we're sort of in this cycle now where, people have been prescribed these medications and, need to be continued on the medications. We've started to run into problems with supply because the DEA ultimately controls how much of these medications are manufactured, and the numbers of prescriptions has increased significantly. So we just don't have enough of the medication to go around, which is disproportionately affecting the people that really need it.
You talk about the people who really need it. Are we to believe, probably fundamentally, because if the number of prescriptions skyrocketed during the pandemic, that there's a lot of people who are getting these drugs who don't really need them, which okay, but at some level, is that so much of a problem? If I want to use something that makes me study harder, why should the rest of the world care?
Yeah, I think it's a good kind of two-part question. I do think there are probably some people getting them that don't need them. But I also think during the pandemic, we've had this increase in awareness, in part thanks to social media, in a good way, where people who maybe hadn't considered that they might have a diagnosis like this have actually gone and gotten evaluated for it and legitimately have been very, very much better off because of it. But I guess as to the other part of the question, if you are being prescribed these medications and you're abusing them, yeah, it's a public health risk in that, people can sell the medications, people can put other people in danger by taking them. And I think that many of especially young people who abuse these medications don't realize how dangerous they can be when they're being abused.
You're a psychiatrist, and I'm wondering why these companies have been allowed to do that. And in a certain sense, is it worth it, right? Because it used to be you had to go see someone like yourself, spend time, talk about these issues. You had a chance to really figure out whether this was necessary or not before prescribing them. The pandemic changed that with telehealth. Is it worth it?
Yeah, It's a double-edged sword for sure, because on the one hand, it's great that we have more access to care for people who may not have been able to access care before, but it is a lot easier to get medications prescribed, and the amount of time that many of these services spend on evaluating patients and actually doing the workup and seeing, is this truly ADHD? That time has really decreased, and they're sort of pushing people through it.
You can't imagine why a for-profit business that makes their money selling drugs would possibly reduce the time that they spend talking to people to see if they need them. Dr. Shepard, it's always good to see you. You bring us a sense of calm and a steady hand in these. Thank you.
Yeah, thank you for having me.
Yeah, good to see you as always. Coming up, thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.